10 signs of testosterone deficiency. Why is this important? Because you are watching this video now and probably thoughts in my head are worth it. I am fine, I do sports, and therefore my testosterone is normal. Unfortunately, this is not the case. Testosterone has several dozen functions, and very often boys come to the reception who have excellent potency, excellent libido, and at the same time they have very, very low testosterone. They can even look very good, athletic, good in terms of physical preparation. That is, they can be enduring, and yet they have completely different problems. Those that interfere with their lives, those that spoil the quality of life. They do not get pleasure. They do not get satisfaction from life. And for many years, they can't understand what the problem is. They go to psychologists, take a bunch of tests, look for problems with the liver, check the kidneys. They think they need to change jobs. Sometimes because of this personal life collapses, sometimes because of this career collapses. That's why today I will tell you about 10 signs of testosterone deficiency, most of which you will not know, and you will hear about it for the first time. Watch this video to the end, and you will understand why you have night trips to the toilet, why you have a short sexual act, why your workouts don't change your figure for the better, and you still go without a press. The first sign is urinary problems. I'm not exaggerating, probably 70 or 80% of young people who have come to see me in the last few months, they came with a diagnosis of prostatitis, but in fact there was no prostatitis. And the reason they developed these symptoms is that they lacked testosterone. And they went to one urologist, as they say, a free urologist, a paid urologist, to the luminaries. These people treated them according to the classic scheme, as accepted in the old school. If it costs, then everything is fine. Checking testosterone is pointless if they couldn't correctly interpret the results, leading to people not receiving necessary treatment. How to understand in general, do you have a testosterone deficiency or not? Look, a healthy man sleeps soundly at night. If you get up at night to go to the toilet, to urinate regularly, it's not prostate. In 99% of cases in a young man, this will be a sex hormone deficiency. And even if you get up only once in the morning and you think that everyone wakes up, no, not everyone wakes up. This is a very alarming sign. This means that you need to go to your doctor, ask him to take your tests, or give them in some laboratory to confirm the presence or absence of a testosterone deficiency. These are not only nighttime signs of testosterone deficiency, but also issues with urination. Do you often run to the bathroom, or have you recently gone to the bathroom and have the feeling that something is left, you have to return after 5 minutes and still squeeze something out of yourself there? Repeated calls to the bathroom, which turn out to be false, that is, you run to the bathroom, try to urinate, but there's nothing there, it's unpleasant. Yes, of course, it's very disorienting. Urination with an abdominal component, that is, you strain your abdomen, deterioration of the stream, even weakening of the urine stream. This can be a sign of long-term testosterone deficiency. When you have been in a state of testosterone deficiency for many years, what happens to the prostate gland? It begins to shrink, it begins to decrease in size, and this leads to the point where such patients have to be operated on due to sclerosis of the prostate gland. Sometimes we get patients, well, let's say, with a huge adenoma of the prostate gland. I'll show you here, this is the prostate gland. Here forms a node which is called a hyperplastic node adenoma of the prostate gland. We call it differently, but in essence, it's an adenoma of the prostate, in simple words. That is, it's a node that compresses the urinary canal. And there is a threshold value when we sometimes want to initially reduce these nodes, reduce the prostate, in order to operate on a person. For such people, we prescribe drugs that block the action of testosterone's derivative, dihydrotestosterone, on the prostate. And what happens? It starts to decrease. A man with a large prostate who undergoes artificial testosterone deficit treatment for 3-5 months can experience a reduction in prostate size, sometimes eliminating the need for surgery altogether. Therefore, a high level of testosterone is the health of your prostate gland, and a low level of testosterone is a problem with urination. This is a disruption of the pelvic floor muscles. This is a deterioration of blood supply, both arterial and venous. This is not just potency, this is not just libido, this is primarily the organic health of the pelvic organs.
Alexander, if I happen to drink tea with cookies in the evening and I want to go to the toilet at night, but if I haven't eaten anything for 4 hours, then I don't want to. How to understand, is everything normal or not normal?
No, well, it's understandable. Even if you have prostatitis and you got out of the Sahara this night, you probably won't wake up. They wake up, they pee, but a healthy person wakes up in the morning because he simply either slept enough or... There are methods. The Indians used to do this. They drank a huge amount of liquid to wake up early. Understandable, but if it's on a regular basis, it's not necessary, of course. Just yesterday, I got up and ran to check my testosterone right away. Of course, no, but if you get up regularly, you know about it. No matter how much I drink at night, I can get up in the morning, and pee for a very long time, but usually I don't get up at night. That is, you need to look at the whole over a long period of time. How is it? You'll understand you didn't get up before. What? You didn't drink tea before, didn't eat liver, and now you started getting up. That is, it's very important to track yourself, to see what you were like 10, 15 years ago, 18 years, 20 years. But if it wasn't there before, why has it appeared now? Think, it means something happened. And what could have happened? Adenoma does not appear in 25 to 30 years. And these things, especially in young people, are most often associated with a testosterone deficiency. And unfortunately, this is overlooked. Diseases are launched. If left untreated, this disease can ultimately require surgery, although medication can correct it if caught early. The second sign of testosterone deficiency, it may be unusual, but it's easy to trace. It's hair, and not the hair on the head, but most often it's the beard and the growth on the face. It's direct often, not for everyone, but most often it's associated with what level of testosterone you have. If you see that you used to shave every 3 days, every 4 days, and now you can basically not shave for 7 to 10 days, and the stubble is about the same size, it means that something has changed in your body. Follicles, especially those on the face, are very sensitive to changes in hormonal background. Therefore, carefully monitor the rate of hair growth. If you notice that the density on the face and the speed of its growth are changing, and also the growth rate is changing, in principle, and on the body, it just doesn't manifest on everyone's body, on the face more often, much more.
Alexander, large bald spots on young people's heads at a young age of 20 to 25 years old. I've heard too, is this related to testosterone or not?
It has been observed that many athletes, particularly those in heavyweight categories, are bald. Here's a category there, 70, 80, 90 kilograms. He competes, well 80 he usually with hair, all heavy there, 110 kilograms, 115. They are most often bald. The dose of testosterone, duration of use, training experience. Yes, androgenic alopecia exists, and it is most often induced in professional athletes. And in ordinary people, either the level of dihydrotestosterone is increased, or there is a very high sensitivity of hair follicles, especially this is the temporal part, and so-called wolf ears are called on the pound. Indeed, if this is your father's, if this is your grandfather's, then this is your genetics. Dealing with this will be hard. It's possible, but it will be difficult. But indeed, if these people turn off testosterone, which, by the way, many patients do out of their own stupidity, using drugs that block dihydrotestosterone, this is treated with drugs that we actually use to treat prostate adenoma. Yes, the hair stops falling out, but at the same time, the prostate begins to shrink. After 4 or 5 years with hair, he comes to us for prostate gland surgery. And we will definitely shoot a separate video about hair loss and the connection of hormones with this. So subscribe, hit the bell, get notifications as soon as we shoot. This channel will definitely get this video soon. Third, I can't lose weight. There is alimentary obesity, where a person is sedentary and overeats. When a person arrives, I notice them immediately from the doorway as they enter. He has low estrogen levels and excess fat deposits on his neck, which is abnormal. Did you notice? Yes, some have 2 or 3 such hanging under the chin, but the most important thing is the abdominal type of obesity. You've probably heard that a man's waist should not be more than 94. Someone says 100 centimeters, someone says 100 centimeters. But in principle, the point is such that a man should not have a big belly. If you observe that most of the fat is internal and there is minimal fat under the skin, it means you lack subcutaneous fat and do not have the so-called overhang. But the belly seems to be protruding from the inside. A feeling of being inflated from the inside, where you can press with your finger and feel your cubes while everything protrudes from within. This is a very dangerous type of obesity because it can shorten your lifespan. Fat, it wraps all your organs, it spoils the vessels. This is hormonally active fat. This is very bad fat, and you will not get rid of such fat by sports. You will not get rid of it by cardio. You can torment yourself, as they say. In the concentration camp, everyone was thin from exhaustion, but you're just replacing one harm with another. Therefore, if you have a big belly and at the same time you have thin arms, thin legs, be sure to check yourself for testosterone deficiency. Abdominal obesity, where fat accumulates in the stomach area, is a key indicator of clinical testosterone deficiency.
Alexander, what about these power lifters? They have a lot of testosterone, big weights, big workouts, and everything is on the belly. Many have such a ball.
Listen, but most often many of them, first of all, use large doses of insulin. Insulin stimulates, unfortunately, the growth of internal organs as well. But these people, they are still healthy themselves. They have healthy hands, they have a wide back. There is no power lifter with such hands, knives, and only with a belly. Yes, they kind of grow all over. We are discussing pathological obesity, where a person is generally thin but has a large protruding belly that overflows the waist. That's right. So, fellow powerlifters, don't be mad at me. You may be very healthy, everything is good with you. Are your joints connected? Yes, you didn't hear wrong. The health of joints and ligaments is often associated with a testosterone deficiency. I have a friend who is into surfing, a well-known media personality. We recently talked with him. He had complaints that despite the fact he runs a lot, does a lot of sports, seems to keep a diet. He has problems with his ligamentous apparatus. His knees just fly away, and it's not typical because the knees experience stress when you weigh a lot by yourself, or some specific type of sport activities like wrestling, for example, jiu-jitsu, as I do. But if you just run, you're just a jogger, your knees will wear out, something's wrong here. And what's dangerous when you already have knee problems? Because it means that you've been walking with a testosterone deficit for a long time. Early detection is crucial because knee pain doesn't appear immediately after testosterone drops, not even within 3 months. But when they start to hurt, now, when your ligamentous apparatus is already being depleted, it will be difficult to reverse at least a large part of this. That's why you need to focus on the signs that appear at the very beginning of this decline. If your ligaments are sick, if your joints hurt, and you objectively do not see the reasons why you are constantly getting injured, be sure to check your testosterone level. And this is very important because if you don't do this, the resource is not infinite. Sooner or later, you will simply bring yourself to the point where only shreds of ligaments will remain and there will be nothing left to operate on. Therefore, especially if you are thin,
How thin the tied one is now.
thinness, that's for sure. We usually see it from the side of deficit. What we have, it's a fat man. In reality, the opposite can be true. If you're extremely thin with no muscles, you may have sarcopenia, a muscle tissue deficit, which is essentially the same issue. Don't assume that if you don't have a huge belly, you're healthy. It can be the opposite. You may be too thin. You know, as I call them, gut eaters. That is, they eat everything in a row, but nothing is absorbed. Such patients need to be checked because a man should be a man, not have twigs for arms instead of fists. Bon. He weighs around 121 pounds, and although he eats and trains, nothing seems to change. God himself ordered a testosterone check. Friends, our discussion isn't about the course, but rather what's necessary. Health, leveling, and bringing things to normal. And these people often have 5 to 50 years of sports, no progress at all. You restore them to a normal level, not some high one. You do not make it on the course, but the normal level of testosterone, and their life just changes before and after. This is very cool, friends. And if you want to know more about men's health and in principle about health, find out what affects the form well, what affects the form badly, and get a lot of interesting information useful, which I get myself studying the latest sources of literature, not from the head I take. Like many bloggers and athletes who record similar videos, please follow the link to my Telegram channel where I regularly release new informational posts. I will be very happy to see you all there.
Passion.
We have already discussed several signs. I'm still going around. Such obvious potentials. Swan, passion, yes. Did not hear about passion. Have you seen such a thing that there are 5 people in the room, the temperature is 25 degrees, you are comfortable, your friend is comfortable, and one sits wiping his forehead all the time, constantly wiping his face with a handkerchief. He is hot, and he always asks you, aren't you hot? He sits there drenched in sweat, sweating excessively. If you've experienced this, like it now. I'll explain how this relates to hormones. With a testosterone deficiency, thermoregulation is disrupted. That is, the body begins to react very strangely to what the temperature is. In fact, it's not hot, but you feel like it's hot. Or on the contrary, sometimes it's not cold in reality, but you feel like it's cold. These symptoms are very, very often encountered with the testosterone deficiency. Special attention should be paid to the night. If you wake up at night, lie in such a puddle of sweat, then it means that something is wrong with your hormones. Or it may not even be related to body temperature. It could be even not related to the temperature of the surrounding air or with the fact that some stressful situation. A person can sweat when stressed or anxious about something like an exam. However, if they sweat excessively at the slightest anxious state, becoming drenched in sweat with wet hands and face, turning red and unable to control it, that is unusual. Sudden surges, heat accompanied by strong sweating. Or, on the contrary, when you are constantly cold, you are constantly freezing, trying to cover up. These are also signs of testosterone deficiency which you never think about. If you experience excessive sweating, or feel very cold, it may indicate a testosterone deficiency. Consider checking your sex hormone levels. Physical exhaustion. Here I am, I'm filming a video right now. Well, not just physical probably, and moral too. And I want to do this, and I'm not trying to find the strength in myself to start doing this, to explain why I need this. Just some creative spark woke up in me today, I wanted to do it. And people with a testosterone deficiency, life is not sweet for them. They don't want to do anything. They don't get the proper satisfaction from what they do. Because this reward system for completing some task is broken in them, they don't get enough feedback in the form of endorphin release. They don't get pleasure from playing football, tennis, from meeting with friends. They just sit there, they don't want to do anything. The dynamics to make yourself go to work, to make yourself not only engage in something uninteresting, but even interesting. You always went to barbecue with friends, went to the cottage, there you had fun, and suddenly what always brought you pleasure, fishing, hunting, or your hobby, suddenly became uninteresting to you. You just want to lie down and do nothing, and when you start doing this, you feel like you're being abandoned. If this is really present in your life, then this is also a reason to go and check your testosterone level.
Is the issue always testosterone related, or could it be due to a lack of sleep over the past week?
I'm not saying that if you felt lazy to run yesterday, you should immediately go and get tested. No, testosterone in life, if it falls, it happens gradually. By the way, in this regard,
Is its peculiarity. Listen.
this can take years, and because it happens gradually, we often don't realize it. So there are special questionnaires. For example, I have a questionnaire open right now. As signs of aging in men. There are many of them, and there are things that you basically don't feel, don't realize, even with yourself. Nothing worries here now. Take it, go ahead, let it lie on the table, clean up the closet, let it lie, give it back to us in 2 or 3 years again.
Check.
I'll definitely post it on the channel. And I want to say that many things because they gradually creep into our life. You know, they creep in slowly. A creeping deficit of testosterone enters our life. It makes us believe that this is normal. Listen, those same night insertions, nobody starts inserting 5 times a night right away. Gradually, sometimes you woke up once a week, then twice a week, and you drank a lot, as you told me, tea, cookies, then 3 times, then suddenly sometimes you started getting up twice. And then, when some critical moment passes, when it causes you severe discomfort, you start to think, you start to Google, you find our video, where you hear that it turns out you may be related to a testosterone deficiency and you go to give it up. And you realize that all these years, when everything else was good, the only thing that bothered you was your sleep. It turns out it was all about the sex hormones. I frequently mention testosterone, but there are actually many sex hormones, and testosterone metabolism itself is complex. But to simplify it as much as possible and not to burden you too much, I either say testosterone or sex hormones. Learn to look at the long distance. Evaluate yourself a year, 2, 3, 4 years ago and feel this dynamic. If it exists, then go. I'm not saying that last week I was stressed, I had exams, I was surviving, I was nervous, I was getting up at night, running. You know, when we're nervous, we often run to the toilet too. That's why I don't like to admit it. Well, you have to be reasonable, but don't forget either. Yes, sikt sonlivos, didn't you hear? It's precisely sleepiness. A common testosterone deficiency disrupts your sleep. Moreover, it can disrupt it not only in the sense that you always want to sleep. If you feel during the day that you critically need an hour and a half to sleep and then you feel more or less good, well, there are 2-3 hours. Although you didn't allow yourself this before, you simply didn't need it. You don't have to think that old age suddenly appeared in the past 2 or 3 years. Think about the fact that perhaps this is a sign of testosterone deficiency and that you simply need the best recovery. You are not recovering from testosterone deficiency, and that's exactly why you want to sleep. Testosterone deficiency is commonly thought to cause sleepiness, but it's often due to another condition. What condition is that? Now, in the morning, for an hour and a half, I fall asleep in a second. Night comes, it's 12 in the evening, and I can't fall asleep. And this condition, especially when you want to sleep, you lie down, but you can't fall asleep. It's the most disgusting feeling when you're kind of tired, you really want to sleep, you're lying down, and you're wide awake. This is also a deficit. That is, when we talk about sleep and testosterone deficiency, we're not just talking about wanting to sleep, but about the fact that any sleep disturbances can potentially be associated. I have a friend, let's not say his name, okay, but his name is Vatang. Hello Vatang, if you're watching this video. We met when he came to me with a sleep problem saying, I can't sleep. He slept for only 1.52 hours per night for 5 years, but now he sleeps soundly. We restored his health. We corrected his hormonal background. Now everything is fine with him. He sleeps like a log. He's with me every day. Can you imagine? It's just torture. I think I can't be wrong. In prisons, I think they try so. When they don't let you sleep, any indications can be knocked out of you. Therefore, you must definitely monitor your sleep. Sleep disturbances are not necessarily normal. Among other reasons, this may also indicate a potential issue with testosterone levels. If you want to sleep during the day, sleep poorly at night, or fall asleep and wake up several times during the night. Of course, the sign that you all know about is libido, but for some reason many of you separate libido and potency. It's crucial to differentiate between two states, one where you can but don't want to, possibly due to a libido disorder, and another where you want to but are unable to. And these are two different signs. Let's discuss both at once. Testosterone deficiency. That is, if you notice that you don't want to have sex with your spouse, and many, I really don't approve of this. They start running on the side to test themselves, and they say that everything is fine on the side. And they think that the problem is with the wife, but most likely the problem is not with the spouse. Most often you just get a high level of stimulation from new sensations. You may begin to believe that love has faded, that your passion has diminished, however the reality is entirely different. Your sex hormone levels have just dropped. In your life, it turns out, something more stimulating appears, like something new for someone. Naturally, potency libido becomes better. If you notice that your morning erections are disappearing, or they have disappeared, or they have become less frequent, if you notice that spontaneous erections have become less frequent, spontaneously, that is, there is no kind of stimulant, just sometimes the penis can get erect. This is also a sign of testosterone deficiency. If your fantasies are weak, that is, you do not fantasize, and sex happens when there is some initiative from a partner, that is, the desire for sex, which comes from you encounter it less and less. If before you needed it twice a week, 3 times a week, and now once a week. If it happens and it's good, and if it doesn't happen and it's even better, then this is also a sign that you have a deficit. Why do I even say that you need to give up not when you have problems, but when you don't have problems? You should know, right now everything is good with you, with what you live with. Because it happens that in principle your natural testosterone is very high. And it will drop, it will still remain normal, but you already lack this. So friends, even if all is well, go get checked out. Examine what you're living with, even when everything seems fine and suits you. If something happens in 5-7 years, you'll remember when everything was excellent. And about potency, the most important thing is that the question is not only in the spouse. It turns out it doesn't work with the wife, and the question is basically about health. And even if you are satisfied, it's sex once a week. Because you've been married for 10, 15, 20 years, and everything is fine, you are comfortable. The question is not whether it's comfortable, the question is that it could be a manifestation of a condition that will eat away at your health. If you see changes in quality, quantity, and sensations, because the feeling during orgasm can change, that is, the orgasm can become dull, this is also a sign. That is, maybe the sperm used to shoot out, but now it just oozes out. This may also be linked to a disturbance in the tone of the pelvic floor muscles or an issue with the prostate gland. That's why, first and foremost, not for the purpose of satisfying their needs, but for the purpose of taking care of their body. If you are experiencing these problems, go and get checked.
Alexander, you always say go and get checked. The list of tests is available, and you can find all the information from various sources. When you go to these laboratories, they charge you for 150 tests.
Guys, a separate video is a must. I promise I will record about female sex hormones, about male sex hormones, and explain how to prepare for them correctly. Unfortunately, many of you are preparing incorrectly and follows the template recommendations indicated on these laboratory sites. I will tell you how to do it correctly so that you can see your real numbers, not those you got under ideal conditions. Briefly, but I think not without benefit for you. We will determine how to interpret the analyses, where we might need to compromise, and what nuances to consider, as one analysis should be examined alongside another. That is, some hormones, they should be in balance with each other. Here is the norm, but you can't look at them separately. They should correspond to each other. I think you'll enjoy this. Follow, subscribe, and hit the bell to see this video on the channel soon. Another important indicator is depression, depressive state, exhaustion, moral feeling that you've reached the end of your tether, that you just don't want anything anymore. This also indicates testosterone deficiency. And if you've already turned to a neurologist, a psychologist to solve some problems, maybe, in fact, and there are many such cases, people go for years, receive medication therapy, and I take them off. When I restore their testosterone level, they just stop needing this therapy. This is a mandatory indication to check your testosterone level. I have such a request to you. I would like you to share your stories in the comments below. What in your life has changed for the worse in the last 10 years? After you've watched this video, looked and understood what things are worth paying attention to. If you write, other people will also read, and perhaps you will share with each other some life changes. This will motivate you and show you that these issues are common. Check it out. I look forward to your feedback. Well, for example, you, without changing jobs, without changing work schedules, started to get up at night to go to the toilet, or stopped sleeping, wake up in the morning and stopped sleeping. Or you can't run as much as you used to. Or you used to lose weight quickly, got in shape for the summer, but now, no matter how hard you try, your physical form doesn't return for the summer. That is, think about what has changed in your life, what resonates with you from this video, and share with us in the comments.